Hey, everybody, and welcome to another edition of the Migraine Mentors minicast. I'm one of your migraine mentors, Dr. Erik Reis, and I'm excited to talk to you today about this topic because it's one of my favorite things to talk about right now. I've been on this journey of exploring vagal nerve stimulation for probably the last 3 or 4 years at this point, and clinically, I've been using vagal nerve stimulators to treat concussions, brain injuries, migraine, headaches, nausea, dizziness, all of these conditions, and I'm continuously amazed every single day as to how impactful these therapies can be. So let's go ahead and get into this. Today's topic is talking about vagal nerve stimulation, the vagus nerve, and essentially why this is one of the most probably impactful migraine modulators out there today. Your vagus nerve, for those of you who don't know what the vagus nerve is, it's a cranial nerve, which essentially means it's a nerve that comes out of the lower part of your brain that goes through different areas of the cranium, but it affects everything and essentially controls everything from like your throat all the way down to the middle of your belly button. It touches every single organ, nearly all tissues involved in the chest and the abdominal cavity. And it's got some really important influences on blood flow, on inflammation, on gut function. I mean, really, the list is quite extensive. And this is one of the reasons why vagal nerve stimulation can be so powerful and affect so many different conditions. There are devices on the market today that are being treated and FDA cleared for cluster headache and migraine. And I have one of them sitting next to me right now, which is my True Vega. And I love this device, and I'll talk a little bit more about it. It's not the only thing out there. I am not endorsing it by any means, but I do think it's something that can be very beneficial and influential for patients. But you have so many ways to stimulate your vagus nerve, and I'll go through some of those. But what's cool about this is that there are clearances being given for these devices. There are devices on the market right now that are being investigated for like PTSD, anxiety, and even depression. And you're like, well, what does that have to do with gut function or blood flow? It's all of the neurological integration that is accompanied with these vagal stims or this vagal stimulation, this vagal system, that really gives it all of this magic. And so the vagus nerve, primarily speaking, is really all about kind of just basic autonomic or automatic function. So if you take a look at, kind of your automatic or your autonomic nervous system, I use those interchangeably intentionally because your autonomics are things that automatically happen or control systems in the background. And it's kind of the yin to the yang. So on one side, you have the stress response, the fight or flight or freeze response. People are relatively familiar with that state, unfortunately. Most patients that come in my clinic, 95% of them are stuck in that default stress, sympathetic fight or flight response state. And the opposite of that state is this parasympathetic, this rest and digest. And this is also where the vagus nerve or vagal system really operates. So you can kind of think of those two systems as like this teeter-totter, right? So they're both on at the same time. It's not just one or the other, contrary to popular belief. And most times people, when they're defaulted into that stress response. So if you're in this stress response, what's essentially going on is you're more stressed, you have more pain, you have more inflammation, you have less gut function, less tissue perfusion, things along those lines. Think of it as like a negative healthy state overall, right? There's caveats to that, because if you get ready for like a big match or a tournament and you're in a stressed state, like that's a really good thing for you, right? But this chronically unenduring, relentless stress state is really where a lot of people find themselves in trouble. So when you're in that state, what's essentially going on is you kind of slow down or inhibit this other area, this vagus nerve system or this parasympathetic system. The teeter-totter goes one way or the other. And what you want it to do is you want it to be balanced. You want it to be going back and forth in appropriate measures. There's a great book written by Dr. Zapolsky, which is titled Why Zebras Don't Get Ulcers. And as silly as the title seems, essentially the caveat for it is that zebras, when they're, in their environment and they're being chased by a lion or a predator, they're stressed, they're scared, they have that surge of adrenaline that we kind of attribute to the sympathetic system. But then when they're done with that and they get away, they go right back to being calm, right? So they're tilted in this stress response, they're running for their life, they're scared, all of these things, but then they go right back to being in that balanced state. And that's ideal for us neurologically, and that's ideal for individuals, especially those who struggle with migraine, vestibular migraines, cluster migraine headaches, like all of these conditions that we attribute to migraine as the full kind of umbrella term. And this is an important factor for so many reasons, for gut function, brain function, sleep quality, mental health. I mean, the list really goes on. So the whole goal is to essentially take you from this stressed state to this not so stressed state. And that's where the vagus nerve comes into play. When you stimulate the vagus nerve, whether it's through belly breathing, humming and singing, gargling, mindfulness, meditation, yoga practices, or using a vagal nerve stimulator, you can take your state back to having that intricate balance. And that's essentially why people are looking at these devices to treat migraine and migraine associated conditions, which is beautiful. And that's why they're getting clearances. That's what the data is showing. But what's actually going on? Well, there's a couple different things going on here. First and foremost is when you stimulate the vagus nerve, you're going to have more neurological integration and function in those areas. You're going to see changes in blood flow. You're going to see changes in your stress responses. You're going to see changes in oxygenation. And all of these things are usually for better, right? One of the other interesting things with the vagus nerve is there's actually anti-inflammatory benefits from the vagus nerve. Now, I don't mean to talk over anybody who's listening to this, but there's a really specific mechanism called the acetylcholine anti-inflammatory pathway. And so this pathway is essentially where you stimulate the vagus nerve. The vagus nerve releases a specific neurotransmitter called acetylcholine. This acetylcholine binds to different immune cells. So there's these alpha-7 nicotinic receptors. You don't need to know that, but for those who want to get nerdy, there you go. They bind to these natural killer cells and they bind to neutrophils. And these neutrophils essentially turn off inflammation that they're creating, which is pretty cool. So not only do you have a neurological stimulus creating a metabolic or an anti-inflammatory outcome, but you have this neurological stimulus also creating neurological changes as well. And with migraine being a neurovascular coupling condition or an issue, but then also on top of that, we know that there's inherent underlying inflammation that's involved with migraine. There's a reason why we've talked about diet and nutrition and exercise and sleep and healthy habits. The stress bucket that we kind of throw all of those things into is really important to consider with this. And so vagal nerve stimulation is so powerful for all of these reasons. And regardless of whether you do it with belly breathing or you use a vagal nerve stimulator or you do mindfulness, the whole goal is to tilt you from this chronically stressed sympathetic state back to this intricate balance between stress and relax, stress and relax. And that's what this vagal nerve stimulation really does. That's why it's so powerful. That's why it has so many lingering and so many multi-reaching benefits to it. And there's just a reason why a lot of people are looking into it and why I'm so infatuated with it. Because it's one of the really purest, true kind of things for me that is on the market today that actually is yielding a lot of benefits for patients. I've used my True Vega. I give patients belly breathing exercises. I give them mindfulness techniques. And a lot of those things make a big difference, especially when you combine them together. And I think that that's probably the moral of the story today is that you can know all of this information about the vagus nerve, the anti-inflammatory effects, the changes in blood flow, all of these things that are really relevant and true and important for considering with the vagal nerve function. But I think the bigger thing is that you actually have to put this into practice. Just like exercise, it's just like healthy habits, it's just like eating well. You can know all the information, but you don't get any of the benefits until you actually put it into practice. So if you are somebody who is still struggling with migraine, if you're somebody who's still struggling with gut issues, if you're somebody who's dealing with post-concussion symptoms and you've got migraine and you've got all these other things going on, the best thing you can do for yourself is get yourself into a vagal state, into a relaxed state, and support your brain neurologically, metabolically, and emotionally, right? So these are things that you should be taking home with you. Try them out at home, put them into practice. One time's not going to do it. Twice might not do it. It's going to take days, weeks, maybe even months for you to get into this, but you are going to see benefits. And the best part about it is it's not going to cost you a ton of money. It's free, right? It's only going to take up your time. It's going to take up your mental bandwidth, but it's going to form healthy habits for you. And that's really what I want to empower you with today. So hopefully you got a little bit of background on vagal stim, vagal nerve therapy, what the vagus nerve is, why it's relevant to people who struggle with migraine attacks and migraine symptoms. And more importantly, too, now you have the tools and the bandwidth to be able to take this and run with it. So if you are a subscriber to the Migraine Mentors newsletter, thank you for supporting us. We get feedback from people every single week on our newsletters, on these podcast episodes. We're very grateful for you. We publish our newsletter every Wednesday morning at 6 a.m. Central Time. So we're consistently just putting out content, trying to help people stay educated about finding non-medical ways or non-medication-based ways to help update their brain software to overcome their migraine symptoms. And if you aren't a subscriber, I got a question for you. What are you waiting for, right? If you're listening to this video, I'm sure there's a reason you're here. Go subscribe. Go find our link in the description below in this YouTube video. Subscribe to our newsletter. It's free. We don't charge. It doesn't cost you anything. And you get all the benefits of the 15 years plus practice that we have clinically that we're bringing to you absolutely for free. And more importantly, too, if you're somebody who's looking for a device to kind of change the game for you, this Truth Vega device is amazing. I don't have any financial incentives or benefits other than we can give you a discount code for this if you want to use it. The discount code is included in the YouTube description as well too. This device usually costs about $500, and I think with the discount you get, I think, $50 off. So it'll be about $450 for you, which can be a notable thing for a lot of people. If not, guess what? You can belly breathe, you can hum, you can sing, you can go do mindfulness meditation, you can do yoga. There's a bunch of ways for you to benefit optimizing your vagus nerve. So thank you once again. I'm Dr. Erik Reis with the Migraine Mentors. Thank you for joining us, and we'll see you again at the next episode.